If given a choice, would you choose an operation to treat cancer which has scientific data demonstrating that it is associated with worse survival outcomes? That means that cure rates are potentially worse. It may surprise you, but there is evidence that this is the case for patients diagnosed with early breast cancer. Many women are choosing operations which could result in lower survival rates and poorer outcomes in other domains. Let's look at the data. In 2015, the results of this study by a team of doctors in the University of Utah School of Medicine on national breast cancer treatment trends was published in the American Journal of Surgery. In the article, bilateral mastectomy was abbreviated as BM, and immediate breast reconstruction was referred to as IBR. Bilateral mastectomy means that both the breast affected by cancer and the uninvolved breast were removed. It is commonly referred to as double mastectomy. Using information from a national database, the researchers found that there was an increase in women undergoing bilateral mastectomy since 2005, despite higher complication rates. This trend persisted through another decade, and in 2024, another team of doctors published this article which reported similar findings. So we have seen the evidence that more women choose to undergo not just mastectomy, but double mastectomy for a single-sided breast cancer. Why is there an increase in the use of bilateral mastectomy? Does this aggressive approach provide better cure rates? Once again, let us look at the available data to answer these questions. In 2017, it was reported that bilateral or double mastectomy did not provide a clinically or statistically significant breast cancer-specific mortality benefit over unilateral or single-sided mastectomy. Not only does double mastectomy not confer a survival benefit over a unilateral mastectomy, this team of researchers found that bilateral mastectomy is associated with higher breast cancer mortality among patients who have a certain type of breast cancer. So the summary message from these data is that bilateral or double mastectomy is not superior to a unilateral or single-sided mastectomy in terms of cancer cure. If that is the case, perhaps the next question is, should a patient choose a single-sided mastectomy? Apart from mastectomy, which is the surgical removal of the breast, there is also the therapeutic option of breast conservation treatment for women with early-stage breast cancer. There are criteria for selection of patients who are suitable for breast conservation treatment, and these are discussed in my other videos, the links to which are listed in the description below. Alternatively, you can ask your surgeon about them. Breast conservation treatment is a combination of breast-conserving surgery or lumpectomy, which is the complete removal of the cancer with a rim of normal tissue around it, preservation of the uninvolved parts of the breast, followed by radiation therapy after surgery. As is mentioned in this consensus statement published in the 1991 edition of the Journal of the American Medical Association, breast conservation treatment is preferable because it provides survival rates equivalent to those of total mastectomy while preserving the breast. The fact that breast conservation treatment may provide survival rates equivalent to those of total mastectomy may no longer be true. In 2007, a team of researchers led by Dr. Martin found that Western Australian breast cancer patients treated with breast-conserving surgery have improved survival outcomes over those treated with mastectomy. In 2025, we have data to corroborate Dr. Martin's findings. A meta-analysis is a sophisticated method of calculation of data combined from several studies to evaluate the consistency of the findings and if the results can be generalized. This meta-analysis demonstrated significant benefits of breast-conserving surgery on overall survival at both 5 and 10 years when compared to mastectomy. In summary, there is data to show that breast conservation treatment is not inferior to mastectomy and may even confer better survival outcomes or cure rates than mastectomy. So the question each woman with breast cancer has to ask herself is, if she has been given the choice of breast conservation treatment and mastectomy by her surgeon, which would she choose? The data in 2025 shows that there is an increasing trend of women eligible for breast conservation choosing double mastectomy in some geographical locations. If you or your loved one were given the choice, would you follow suit or choose the operation that has data suggesting better survival outcomes or cure rates? I am an advocate for breast conservation treatment for all eligible patients because of the current available data, but each patient would have to make the choice that she is most comfortable with. Thank you for watching until the end of the video. I hope that the information provided has been useful. Please like, share, comment, and subscribe so that together we can help women have access to the data that they need for breast cancer surgical treatment. It is my hope that patients will make wise choices that enable them to live longer and live more. Until we come together again in another video with essential data for decision making regarding breast cancer surgery, take care.